I take a tremendous emphasis in making them unbelievably comfortable. Everybody says they're painless, and everybody tells you that they're not going to hurt you. But yet, most patients come fearful of the dentist. Something happened wrong. And that's the biggest selling point that I have to offer. When you come here, I won't hurt you. There are things that we can do that most dentists don't do, and which I don't understand why, to make it very comfortable. There's medications you can take to decrease anxiety, very, very safe medications. There's nitrous oxide to make things comfortable for you. There's topical anesthetics that are so strong that when we put them near the teeth, just a cream, the teeth get numb. So certainly if we put a topical anesthetic on the gum tissue and then wait a few minutes and then anesthetize the area, you don't feel it. Most of my patients don't feel me give them the Novocaine. So they're comfortable. And what is it that makes going to the dentist the most fearful and anxious profession probably to go to of all the professions is worrying about discomfort, worrying about being uncomfortable. And I spend half my appointment making sure that patient isn't going to feel anything. And so that when they leave there, it wasn't that bad. And they can honestly say to their family and friends, I didn't feel anything. I have doctors that have worked with me and for me in my other practices. And they go in there and the patient's scheduled at 9 o'clock in the morning. And they have another patient scheduled at 9:30 in the morning. So they have to finish that procedure in a half an hour, which is commendable, that's great. Except, although the procedure is going to take them a half an hour to do, they forgot about the fact that they needed to make the patient comfortable. And making the patient comfortable takes time. Whether that's me explaining the procedure to you to get you comfortable in what we're doing, so that you have an informed consent and you know what to expect, or putting the topical anesthetic on and waiting 5 or 10 minutes for it to work. I laugh sometimes when I see some doctors working, and it looks like they might as well have taken the Novocaine needle and dipped it in the topical anesthetic and just put it in there. Well, it can't work. So they're doing things that inherently are uncomfortable. The easiest way to know that is when I am a patient myself. I remember all the time how annoying it is to be in a dental chair. And I don't want to feel anything. And I know what I would do to myself to make sure I didn't feel anything. And I wouldn't want any of my family to feel anything, so why would I want any of my patients to feel anything? One of the other things, simple thing, we have an iPod with 50,000 songs on it, all genres of music. When I'm sitting in a chair and I'm listening to the music I want to listen to in a comfortable setting, my mind is at ease, a little bit. All different types of things to try to make it not a horrible event and something that is actually somewhat pleasant.